So
And then
I will
right,
say,
yeah.
I will start. I will say a few words, and then I will let you speak, and then I will introduce Sharonit. Okay?
Great. And Eldad, do you want to keep the presentation in this view, or do you want to do it as a slideshow where I can't see the slides on the side? So I can't,
Yeah, like that.
like this. Okay, because there's a way that you could do it where you don't see the slides on the side.
Yeah, she don't need a. She's in front of her face.
Okay. Okay.
Ah. Okay.
So will that you start and then me, or I start?
Yeah,
and
yeah.
then-
I will start. I will say a few words. I have some words I prepared, and then I will introduce you, and then Sharonit.
Okay.
Guys, one more minute.
Sharonit is there?
You want me to start letting people in?
Of course.
Okay, I'm going to go on mute and we're going to start letting people. You're not going to be on a practice session anymore.
נכנסים עכשיו מלא אנשים.
People logging on. We're up to about 40 people so far.
אז לעשות, להפסיק את ההתחלה, ואז שאני אעלה, אתחיל לדבר. שיראו אותי בהתחלה.
אתה מופיע פה על הצד או רואה?
אני בצד רואה את עצמי.
רואה את עצמי. המצגת שלך לגמרי, נכון?
כן. I see the people are entering more and more, so we'll start in 1 or 2 minutes. So good morning, everyone from Israel, and good afternoon to Europe. My name is Eldad Helft. I'm the president-elect, and I would like to start our second Zoom meeting for this year. Tomorrow evening, we'll celebrate the exodus from slavery to freedom and the transformation of the Jew into a nation. In a month, we will celebrate the Independence Day of the State of Israel. A day where after 2,000 years, the nation of Israel once again became free. And even today, we are still fighting for our freedom, both in Israel, around the world, for our right to live as a free Jew. The last events prove us that our enemy are trying to, in every way, to harm us and to destroy the state of Israel in every possible way, not only here, but everywhere in the world. They are trying to harm us just because we are Jews. The big difference is that this time we are free people. We have our own country, and we will not allow anyone to harm us in any way, neither here in Israel or anywhere around the world. And each of us will fight for his right to live as a free, proud Jew. Hence, the importance of Alpha Omega. We are the largest and the stronger Jewish professional organization. Alpha Omega was founded 170 years ago to fight anti-Semitism, and our organization are more relevant than ever. This Pesach will be special and different for me, and I'm sure for you also. Every year, the Seder night is a happy evening, but this year it will be also a sad one because of the fear for the Chatufim, the kidnaps, and for the Israeli soldier of the defense forces who are still fighting for defense our country, including my son. And we'll all pray for their safe and speedy return. Pesach is a holiday of hope. We finish reading the Haggadah with saying, L'shana haba b'Yerushalayim, next year in Jerusalem. And despite the situation, it requests us to continue with our life as much as possible normal. And it maybe seems strange to you, but this year, and especially this year, we'll all meet in Jerusalem for our annual convention, a convention of identification of Alpha Omega with Israel, and especially with the dentists in Israel. We'll meet and hear firsthand about the holy mission the dentists fulfilled with the identification of the victim of October 7th. We'll deliver Magen David Adom, also ambulances that Alpha Omega donated. And we'll meet with Natan Association that took care of the evacuation with our help and provide them dental treatment. We'll also learn, celebrate, and spend time together. I invite you to come and register as early as possible, and also to convince more friends of you to come in December to Jerusalem. Today, I have a special privilege to introduce our lecturers, but first of all, I would like to introduce Dror Eisenbrot, the head of the dental school in Rambam Hospital. Dror, please. Unmute yourself. Thank you.
Good morning, Alpha Omega friends and colleagues from Israel and around the globe. I'm Dror Eisenbrot, the chairman of the School of Graduate Dentistry in Rambam, Israel. It is a great pleasure to introduce Dr. Sharonit Sahar Helft, a senior physician in the Endodontic department and our Rambam School of Graduate Dentistry International Public Relations Coordinator and a close friend of mine. Sharonit will present this afternoon the second lecture of the Alpha Omega Rambam Dental Webinar Series entitled Endodontic Secrets to Successful Root Canal Treatment. As Eldad mentioned, tomorrow afternoon, we will celebrate Passover Seder with our families. Every year, for so many centuries, the Passover Seder is the same. The same Seder, the same text, the same symbolic food. However, this year, Passover is so different. It arrived after 6 months of brutal war between Israel and Gaza, with no end in sight. 1,200 Israeli and more than 600 soldiers were killed. 133 Israeli hostages, their status unknown, still held by Hamas, and their families were destroyed. Deadly missiles raining down on Israel from Iran and from Lebanon, and many families from the south and the north cannot return to their homes because of a constant threat. In these special circumstances of October 7th war, we in the School of Graded Dentistry in Rambam keep our mission to continue and improve Northern Israeli population oral health. We also continue with the important mission to keep high level of dental education in our various residency programs. Passover Haggadah, written so long ago, speaks directly to our current reality and remains as relevant today as ever. Its text and ritual, passed down through generation, convey the important message of hope and resilience. Am Yisrael Chai, literally, the people of Israel live, is the slogan of Jewish continuing and resiliency, and resilience frequently evoked in moments of communal hardship. This Passover, Am Yisrael Chai slogan means for me more than ever the fight of Am Yisrael for liberty and the hope for releasing the Israeli hostages. Happy Passover to all, and thank you for your fraternity. Please welcome Sharonit.
Okay, hi everybody. I'm glad to be with you here today. Wait a minute, I wanted that's it. Everybody, you can see my presentation? It's okay? You can see
Yes, it is. Yes.
So I'm very happy to be with you here today at the morning, at this time of the day, and to share with you my knowledge about the secret successful in root canal treatment. So if we want to have the successful treatment, we need to answer, or actually we need to ask ourselves 3 questions. First of all, what is the cause of the inflammation? And the answer is the bacteria. But actually, we have bacteria in our digestive system. We have bacteria on our hand, on our body, And how come in oral cavity the bacteria become a pathogen? Because in oral cavity, we are talking about a microorganism that get together and become a biofilm. And when there is a lot of bacteria, they started to divide it and create a biofilm, the balance between the host and the bacteria is disturbed. And inside our cavity, they started to grow and to divide it. There is a sugar, the food for them, and they continue inside the root canal, and we can see the bacteria all over the root. So there is a very straight link between the biofilm and apical periodontitis. Whenever we have apical periodontitis, we are talking about biofilm. You can see it over here in the picture. They are all over in the anatomic construction, in the lateral dental tubules and lateral canals. So when we are talking about the biofilm, we are talking about microorganisms. There are 5 steps in order to create the biofilm. First of all, wait a minute, I heard that there is a problem.
Yeah.
What is the problem?
Yes. The slides are not passing.
The slides are not passing? Okay, wait a minute. I will go out. Excuse me for a moment. And then I'm on the Zoom. Wait a minute.
Okay. You can see now.
Wait a minute.
Now.
Now you can see it bigger, in big size? It's okay?
Okay, now it's better.
Okay. So we talk about the bacteria and the biofilm. Excuse me for the interruption, but they said to me that the slides didn't move as it should be. And there is the connection between the biofilm and apical periodontitis, and we can see it all over. And when we are talking about biofilm, we are talking about complex of the microorganism. There are 5 steps in order to create the biofilm. First of all, we are talking about planktonic cell, free floating, and then they are attached to the surface. After they are attaching to the surface, they become divided and to create a bigger divided and create communication between the bacteria. We call it quorum sensing, and started to grow, and there are more bacteria that came and started also to have motility, the movement. And when they have enough bacteria, they have enough around them, so they'll produce the self-matrix membrane. When the biofilm become old, there is less oxygen, the membrane is wrapped, there is a cracks over there, and some of the bacteria started and create a new biofilm. In the right slide, you can see here some of my studies. Here you can see scanning electron microscope of the Enterococcus fecalis in a biofilm formation on the root canal. And here you can see very nicely those signaling system, we call it the quorum sensing, and we wanted to see if the erbium-Young laser can interfere this conversation. And what we saw that when we use the high power of the laser, we saw that the communication between them, the information transport very rapidly. It's like Babel building. So they can't understand each other. They couldn't create the biofilm. And the other thing, we call it the motility, the movement that they are doing in order to be in one group. There's no motility when we are talking in high energy of the laser. So this is how we can prevent the producing of the biofilm. But actually, when the patient comes to our clinic, we are talking about biofilm that is already exists. So let's see how we can handle this situation. So here we can see a patient in 2016. He has medical history. He has special needs, and his dentist produced him the bridge, the maxillar, and the mandibular one. It was very nice, and everybody was happy. And 2 years later, the patient complained, I cannot eat on my left side of the jaw. It's hurt. And clinical examination, I'll present it. We can see new restoration. The percussion was very painful. Palpation was, it's okay. Periodontic problem was normal. And we can see here larval gelucency that started from the apical area to approximately middle of the root canal. So what will be the treatment planning of tooth number 32? Usually there is an audience and we started to talk. There is here 4 options, but here I will talk alone. So what are the options of the treatment planning? We can do root canal treatment. We can do extraction and create new restoration. We can extract the tooth under the bridge in order to preserve the new bridge, or antibiotics and periochip. So let's start from for the last opportunity. Antibiotics maybe we need because it has pain for percussion, but periochip, it didn't have any problem with the gum. The probing death was okay. So I don't need the periochip. It can help me here. And when we are talking about extraction, so extraction and create new restoration, well, it's almost new restoration. So we want to avoid it. So we have 2 possibilities. To extract the tooth under the bridge, but actually, first of all, if I want to do it, I need to do a root canal treatment. So let's start from the beginning. Let's start here in this case to create root canal treatment. If we are talking about this kind of radiolucency, according to the AE, we know that when you have a large radiolucency, it's not a absolutely indicator a poor long-term prognosis. But other articles said that when we have long-standing infection, it's present a lot of bacteria biofilm in dental tubules. And in this situation, it's to challenge us in this treatment. But here you can see the length measurement. Of course, I started with to treat this case. You can see in the right the length measurement that I took. But I wanted to see what happened during my activity, my working on the root canal treatment. And today, the endodontic field made a big step in the last 10 years. You can see a lot of rotary files, a new one in different formation. We have also CBCT, but we wanted to see how I can remove the bacteria from the entire root canal. And we know that it doesn't matter which system I will use, I have those places that remain untouched. All these green places, you can see it in the picture, remain untouched, which means the bacteria is over there. But I wanted to see how I can remove it. So you can see I use here extracted teeth. I removed the coronal part. I made 2 lines on the root and I separated into 2 parts. And in the left side, it's the impression material in order to create the same configuration of the root canal. And I work inside and I wanted to see what happened in the coronal, middle, and apical area of the root canal. And we can see very nice picture, the scanning electron microscope. We can see the smear layer that covered the surface of the canal wall. Here we can see the main root canals. Those are dental tubules. We know that the smear layer contain organic and inorganic substance and may be infected and may protect the bacteria within the dental tubules. If we are looking at 2020, we can see that more articles we have about the irrigation solution. And what's ideal irrigation for me, that's why I need to add it to my root canal treatment, is strong antimicrobial action, dissolve pap tissue, remove the braids and smear layer, and of course that I will have a successful treatment. That's what I want. So we are using usually the sodium hypochlorite, and we can see and we know that it's antimicrobial very nicely, but it cannot remove the smear layer. I can see those dental tubules that are open, and I want to mention that we have inside the bacteria. So today we are not talking which irrigation solution shall I use, or we are talking about what the methods of the irrigation shall I use. So I wanted to, the irrigation solution will reach at the end of the apical area. So we have many kinds of the needle with open end, with knife edge, with open only in one side or 2 sides. It depends on you, whatever you want to use. We have to take in consideration the space available in apical third and the flow rate of the irrigation. And here in my study, I used the 27G, and I wanted to see what's happened in the coronal area. I used the EDTA. We know it's a very good chelator, so it's helped me to remove the smear layer, and we can see very nicely open dental tubules. What will be in the middle area of the root canal? Some of the dental tubules are open and some of them are closed, and there are remnants. And what will be at the apical area, you can see the irrigation solution didn't reach or didn't make it his activity at the apical area. We know that only 1.5 millimeter transmit over the end of the needle. So I needed to add something in order to have a successful treatment. So we are talking about only one root canal, and it's not a problem, but it's not so easy also, because you can see very nicely how I can clean the middle of the root canal, but those area remain untouched. And over there, we can see the biofilm very nicely, the size of them, but they're all over, and it's make me difficult. So let's play a little bit endo. Okay, this is my case, and I clean it, and I wanted to cut in my game. The third apical area, this is the RAMBAM shame. I start like this. And here you see I cleaned very nicely in the middle. Those areas remain untouched. So I took another bigger file. I cleaned it better. You can see here around a bigger area that it's clean, but those remain untouched. I don't want to get to this kind of situation because here I can suffer from thin wall and I will have vertical root fracture. And now I want to obturate. So here you can see the root. Here you can see the good aperture, and what will be at those area. This is what I have. This is one dental tubules, and you can see the bacteria is 1, 2, 3, 4, 5. They are all over. So we said about that we are talking about methods of irrigation. So we can add the passive ultrasonic irrigation very nicely. It's make acoustic streaming, the turbulent of the liquid over there, and we can remove the smear very nicely. But, you know, every time we have but. If we are talking it's right canal, so it's very nicely. But if we are talking about curved canal, when the tip of the ultrasonic touch the wall, we feel that it's work, we heard that it's work, but it doesn't work. It doesn't make the acoustic streaming, the action that I want that it will create. So in order to have a good result, we need to know and to take care, if we can, how we should work with this instrument. But here I continue with my research and I use the passive ultrasonic irrigation, the ultrasonic with the EDTA. You can see very nicely a picture from the coronal area, very nicely a picture from the middle area, and this is what happened from the apical area. The main root canal, it's clean, but the dental tubules, they are closed, and it's not enough for me, because over there inside, I have the bacteria. So that's why I tried the laser technology. And you can see here the bubble it's create, and we take a tube, we put inside color, and after we work with the laser, we can see a transparent tube, which means we could remove the color or the bacteria inside the root canal. And I wanted to, again, I continue with my study, and here I use the EDTA with the laser tip. This is the picture from the coronal part of the root canal. This is what happened in the middle part of the root canal, and this is what happened in the apical. So you can see a full picture of the root canal in 3 places, and it doesn't matter if I at the coronal area or the apical area, I have the same result, a very good one with no bacteria, no smear layer, and in this situation, I can have a success rate, a higher success rate in my treatment. And what the benefit of the laser? We can deliver a very low to very high concentration at the exact point, very efficient. And if you will see the properties of the light, the normal light is non-coherent, broad spectrum, and non-collimated, and this is what happened with the laser. It's coherent, monochromatic, and collimated. So when we are talking at this situation, I of course use my instrument, I added the laser, and I finish the treatment like this. And this is what happened after 2 years. We can see a healed area of the root canal, and of course, everybody is happy. We remain with the same bridge and with no pain at all. So let's have another challenging case. This case was done in Hadassah when I was over there with the postgraduate Dr. Irit Meidan. So this patient came to our dental clinic, and he said, well, actually I have this wound for almost 5 years. I don't have any hurt. It's okay with me. But they said me, I came here because the prosthodontics and the periodontics said to me, go over there to the endo department. Maybe they will have you, they will treat you. So I present the clinical examination. Mobility was grade 2. Periodontal probing was 7 millimeter. Vitality was negative. And we can see the abrasion at the incisal area, loss of bone support, and radiolucency at the apical area. And you can see at the CT what's happened. actually what can we offer here? But if we want to know what to offer, first of all, we have to know what is the diagnosis. So we understand that we are talking about necrotic pulp, chronic apical abscess, generalized aggressive periodontitis. So what is the initial treatment that we should perform in this case? If it's the perio problem, so we need actually to start with the perio treatment and then to do endodontic treatment. If the main reason is endo, the primary endo, so I need to start with the endo and then to continue with the periodontal. Or there can be a combined lesion, which means there is a problem of the perio, there is a problem of the endo. We need to treat him in the same time in both fields. And that's what we have, combined lesion. So what can we offer to this patient? We can offer him root canal treatment and periodontal treatment, or extraction, bone augmentation, and implant. Actually, the prosthodontics came to us and said, you needed to treat this patient and you need to do whatever you can in order to keep this tooth in his oral cavity, because to extract it and to put bone augmentation and implant, we have a very problem of aesthetic problem. And we have been once in this situation and we don't want to be it again in this patient. So we ask your help and your knowledge, and this is what happened. So we started with calcium hydroxide, and the postgraduate did it for 4 times, and the sinus tract remained in the same situation. And then we mixture the ciprofloxacin and metronidazole paste, and again, the sinus tract was there, and they come to me and said, Sharonit, please help with your laser technology. Maybe this will have opportunity to help this patient. And here you can see I used the laser with the sapphire tip with the EDTA, and we obturate it. And 1 year later, the teeth is over there. And 2019, the tooth is remain over there. There's no sinus tract. There was implant in the posterior area. And of course, everybody happy with no implants and no bone augmentation. And we succeed in this situation. So, okay, laser, it's okay, but which laser shall I choose? We have 3 kinds of laser. We have the diode, the CO2, and the erbium YAG laser. I will decide it according to the absorption laser beam in the tissue. If we need to work on the soft tissue, we can take the diode or the CO2, because we can see that it's absorbed very good in melanin and in the hemoglobin. But when we are talking about the erbium YAG laser, we can see that it's absorbed very good in the water, in hydroxyapatite, and also the CO2, but it depends which one of them. After I understand that it can help me to work with it, I need to know how it will work. So if we are talking about, again, erbium YAG or erbium chromium YSDG, there are 2 lasers that their wavelength, it's approximately the same. We can see very nicely that the laser beam and the influence in the tissue around, we can see there is stimulation. And we know that it's a superficial type of the laser, which means I work very gentle, layer by layer, and I control the influence of the laser on my target tissue. If we are talking about CO2, we can see here there are 2. One, it's good for the soft tissue, and there is a new one for the soft and the hard tissue. But look how we need to work in non-contact mode. There is the lumen, there is carbonization, coagulation, and stimulation. And the diode and the EndoYAG, they are deeply penetrate type, which means I work with it, but I know the influence will be deeper. And you can see there is carbonization, coagulation, and stimulation. And here what happened when I use only with EDTA, and when I use here laser with EDTA, we can see a clean dental tubule. You can see all the configuration of this dental tubule, and with this kind of situation, I have a high success rate in my endodontic treatment. So after I understand that I can handle with the bacteria, the second question that I need to answer to myself is about the diagnostic. I need to know exactly the diagnostic of the cases that I'm handling. So let's see this patient complain, I cannot eat on my left side of the jaw, it's hurt. We are talking about tooth number 35. You can see here two kind of radiography. You can see that we have the crown, decay, and you can see over here we have lateral area of radiolucency. It's not from the apical area. So if I will present it, the clinical examination, we can see the crown restoration, periodontic probing was with bleeding, percussion was with pain, palpation was okay, and we can see at the distal area, we can see radiolucency. And what is the reason for the lesion? So there can be three possibilities. One is chronic apical periodontitis, and the answer is I should do retreatment of this root canal. Secondly, maybe it's vertical root fracture. So I need to extract and put an implant. Or if it's can be during the implant procedure, bacteria was inserted into the bone, and here I need to only to put antibiotics. So let's start again. Let's start from the third option. So usually if there was bacteria that was penetrate during the implant insertion, so I should have seen bacteria around the root canal, but around also the implant. And here the bone is okay. So antibiotics, to give only antibiotic is not the right answer for these questions. So maybe it's vertical root fracture because the lesion is a side. And if we remember that I said the probing of the periodontal pocket was only with bleeding, so which means there's no vertical root fracture. And also in the X-ray, it's not a halo form of the vertical root fracture. So we remain with chronic apical periodontitis, so I need to do retreatment. So I understand that the lesion is a side, and the question is how I can efficiently clean the lesion through the root canal, because it's a side, it's not in the apical area. We know that there is maybe lateral canals we can see, or dental tubules with infection. And what we saw during the years, we saw that it's very important the distance, the tip of the laser from the target. So this is what Professor Adam Stabel thought, that maybe we should not use the sapphire tip that it's on the coronal area. We should use some tip that go along through the root canal, and then it will give the energy laterally to the wall of the root canal. And Professor Adam Stabel, with light instrument from the Israel, create the side firing endotip. It's very efficient because the laser is near the wall of the root canal. It's safe because at the end of the tip, and the end of the tip is closed, and it's very easy to use. I hope that you will see the movie, and here you can see how we can treat. We put inside the liquid, the EDTA, and then we use the side firing endotip up and down, 50 seconds, 4 times. Okay, we add it again, we turn a little bit, and then up and down, and this is how we are using. So here you can see the length measurement that I used. I put inside the endotip, you can see it very nicely. The energy goes laterally. I use here the EDTA. This is what happened usually with my regular instrument, and after I use with the laser, you can see a dental. Here, this is the main run of the root canal. You can see the dental tubules, they are open at the opening and also through along of them. And if you can see, I don't know, the lateral, you can see here, lateral canal that was obturated. And this is what happened after 1 year. Very nicely, we can see a clean area, a healed area at that point. Okay, so here it's a very nice case about retreatment. It's a challenging one. And we are talking about young girl that has inflammation. Wait a minute, that I will see everything. That's it like this. I have inflammation at that area, at the palatal area. She had an old restoration and periodontal probing was normal. She had it was very painful for her, the percussion and palpation. And we can see large radiolucency at the apical area laterally. And I examined also tooth number 23, vital tooth was a normal, with the normal apical tissue at the apical area. So what kind of treatment we should prefer? Shall we do extraction and implant over here, root canal retreatment, apicectomy, and root canal treatment on tooth number 23? So let's start from the apicectomy. Okay, if we want to do here apicectomy, we actually need to do also root canal treatment to tooth number 23 because maybe during my procedure, I can disturb the blood irrigation at the apical area of tooth number 23. And the relation between the core and the root canal, it won't be so good. And even if I will do whatever I need at the apical area, inside the root canal, the bacteria exist, which means it depends only at the matter of time until the illness will begin again. And extraction and implant, actually, the patient didn't want any extraction and implant. And she said, you see, until now, I didn't put any implant and I don't want it either now. So we remain also only with root canal retreatment. And here you can see I started with my retreatment, the length measurement, and you know everything is happened. When we are in our clinic, it's okay, but sometimes it's become Friday afternoon before Shabbat dinner, and she said to me, Sharoniti, the situation is not so good. And I said to her, you know, you have a camera, please take a picture and send me by the phone. And this is the picture that she sent me. You can see inflammation, a big one in the palatal area. So, of course, said to her, please come to the clinic and I will help you. But before I will help you, shall I change now my thinking about how we should treat this patient? Maybe although she didn't want, I need to go back to extraction and put an implant. But in any case, I said to her, you know, please come, and I make here drainage, and of course with antibiotics. And then I said to her, I will try to help you with the side-firing endotip. I did the laser treatment, and the laser treatment is occupying through two mechanisms. Once is the laser irradiate directly the bacteria and I ablate them. And the second thing is the laser activate the irrigation. So when the laser is absorbed in the liquid, there become bubbles. But when the bubbles become bigger, the high pressure liquid we have from the outside, and it creates bubble collapse and we create cavitation damage. Many cavitation damage create shock waves, and through the shock waves, we can remove the bacteria and the smear from the wall of the root canal and from the dental tubers. And this is how I work inside the root canal. The laser, you can see here the energy that go out with the EDTA and with the suction, and I obturate the situation, and this is what happened in 2023. You can see there is a healed area with no root canal treatment on tooth number 23, with no apicectomy, and of course, everybody is happy. And the last questions, what do I need to do in order to have a successful results? So we know now that the laser have a role in our endodontic treatment in order to have a high success rate in our procedure during our activity in the clinics. So again, the relocation, I like to work after clinical cases because it's work more than only to show abstracts and articles. So this patient complained, I cannot eat on the right side, and you can see what we have here. We have a temporary crown, or actually we have a destruction of the crown. And we have here a clinical examination, extensive destruction. We have periodontic probing was normal. The mobility was normal. Percussion was painful and palpation also. And we can see root canal treatment that was poor treatment at radiolucency at the mesial and distal roots. So here again, what shall we do? Extract an implant, root canal retreatment, apicectomy, extraction, and prosthetic bridge. So in any case that we can choose, what I didn't tell you, everybody, okay, so in this situation, most of the dentists and also me will choose extraction and implant. But there is one thing that I didn't tell you, and it's very important, his medical history. And his medical history, he's taking bisphosphonates. And in this situation, the apicectomy, the extraction, and whatever you want to do, you can't. So I remain only with retreatment, this patient. What will be the obstacle in this treatment? First of all, to put a rubber dam. Secondly, to remove the old root filling material. And then I need to reach to the apical area, to the source of the problem. And after I reach to the area, can I remove the bacteria in this in ramification and dental tubules? You can see very nicely how we can work inside the root canal after I get to the length measurement at the apical area, but you can see also the places that I can't reach in those areas. And of course, I use here the laser. And when I'm using a laser, we know that the laser, it creates also photothermal effect. So I need to know what the high of the temperature the laser can create inside the root canal and outside the root canal. So I use this schema of downstairs. I measure it from the coronal, middle, and apical parts. And I work in 3 different methods. The control one is the laser for 60 seconds without a liquid. The segmented is 4 times with EDTA, 50 seconds, or continue with 60 seconds combined with the EDTA and with the laser. And you can see through the results that when I'm using only a control group, we can see in every time I have a high temperature, more than 10 degrees, that allows me to work inside the root canal. And in the continuous irrigation, 50 seconds 4 times, or segment, or the continuous all the time, or the segmented, I have very good result. In any case, it doesn't got more than 5 degrees inside the root canal and outside. So here you can see that I use the laser over there, I obturated, and you can see very nicely I have a success treatment also in a patient that has medical history that not so that sometimes it's make a challenge in our treatment. And why I have this kind of successful? Because we can see that when we are checking about the bacteria, EDTA, erbium YAG laser with EDTA, I work inside, and then I use the sodium hypochlorite. I have very nice result if I compare it to sodium hypochlorite alone, or of course without anything. Or even if I compare erbium YAG laser with some of my laser or EDTA, I have the best result, EDTA with erbium YAG laser, and at the end, I irrigate with sodium hypochlorite. So whatever I want to do, incision, ablation, or hemostatic, during this activity all the time, I'm doing also disinfection. In conclusion, we have to know our diagnostic. Then we have to understand our ability to treat those cases and our equipment. And of course, we can see that the laser has a role in our success in endodontic treatment. To whom want to have more knowledge about the laser, there is the International Society for Laser Dentistry between 6 to 8 in June, in about one and a half month. We have over there conference very nicely. Of course, we will be there, Professor Adam Stabolz and me. We are over there a keynote speaker, and you are all invited to hear us over there and other questions. And thank you that you have been with me until now. Go for this.
So thank you very much to Sharonit for a wonderful lecture. And before we'll continue, I want to remind you that our next lecture will be on the 5th of May. It will be presented by Dr. Ronnie Dakar, head of Department of Endodontics. It will be also a wonderful one. So let's see if there are any questions. Just a moment, I want to see the question.
Does the endo tip with the laser work in curved canal? Yes, it is, because the tip is not straight. It's very nicely, it can bend inside the root canal. Well, the second question is, will dental have work as well? I don't understand the question.
Dental wave.
Dental wave work as well. I don't know to tell you about the dental wave. I know about the laser, so I can't answer this question actually. Should the general dentist be doing root canals? Yeah, the general.
I would say it from my own practice, no. It's better to have endodontic in your practice. It's save your life.
But actually, general dentist can do a root canal. We are teaching them during his learning in dentistry. But of course, if there are some cases that are challenging, please refer to endodontics and your life will be better. Okay. The canal when gutta percha is, whether do you ledge the canal when your gutta percha to apex? I don't understand the questions, please. Fabricius, if you can ask me more specific. If I can do a ledge with a laser? So no, with the laser you cannot do a ledge because it's only go after the way that you create. The tip can't create it's not instead of enlarging the root canal. It's not hemomechanical information you need to do it. It's only at the end of the root canal. It's only to antibacterial effect actually.
Which laser is believed is better, Corona or BioLaser?
Well, I'm very happy that there are more companies that are dealing with a laser, because that's how the dentist have more opportunity. Every laser is good. I don't think that there is one particularly. It depends what you are doing, and it depends, which company you prefer. It's your opinion. And when I talk about the diode laser and the erbium YAG laser, let's say it depends what you are doing more in your dental clinic. If you are working with a soft tissue, it's better that you prefer laser that work in the soft tissue. If you are working on the hard tissue, so maybe you should have the erbium YAG laser that work on the hard tissue and on the soft tissue.
Is it safe and effective to use on a young permanent teeth when the apex is open?
Well, yes, but you have to work very carefully in order, the laser can work at the apical, also at the apicectomy. We work very nicely with the laser, but you need to know how to work with it in this situation. But yes,
What is the size of the tip of the laser? Is it smaller or is it 35?
it is the 30 file at the apical area. At the coronal area, it's 1.5 millimeter. It fits the ProTaper Gold, the ProTaper Next, but not the Ultimate. They now started to create with a new smaller diameter. So you need to use some instrument that it's according to the laser tip.
Either a minimal apical enlargement that is necessary for the laser to fit.
Yes, so you need to enlarge it until 30, number 30. It's the blue file that you are using, the handle one.
Yeah, you're doing the mechanical preparation as normally, but the laser then used for anti-inflammation and sterilization the canal.
Okay, again, which laser is better at cleaning the canal? Photonal laser, water laser, bio laser, everybody is okay. Also the erbium young of the light instrument, very good. I'm working with a light instrument actually, because only they have this kind of the tip. Well, I have many excellent lectures. Thank you very much for all the audience that was happy to hear me.
Does a laser tip fit different laser erbium units?
No, only the light instrument laser. You can't, because you need it has to fix to the hand, and only the light instrument has this form.
How close to the apex you place the laser?
Until the end, because the end of the laser is closed and it's very safe to use it. That's why we can use it until we should do it until the apical area, and this is my challenge area in order to clean it over there.
The same question, can irrigation do beyond the apex with using laser?
Well, no, with this kind of laser, with this kind of tip, it's a safe tip, and this is that you work very nicely. But actually, I use inside EDTA and not sodium hypochlorite, because according to my study, I saw that with erbium laser with EDTA, it's better to remove the smear and the bacteria.
Does the laser tip come in different sizes?
No, only one size till now.
And do you sterilize the laser tip?
Well, they are saying that it's only one use. Well, we are not using only one, I have to tell you. I try to use it a little bit more than one, but it's not according to the company. But I clean it. When I use it in the sterilization, sometimes it goes out very nicely, but sometimes it becomes dark. And when there is a different color of the tip, so you need to throw it away.
To which size of the file should prepare the canal? So you said before number 30?
Yeah. Why don't you use sodium hypochlorite in the canal with laser? That's what I said in my research. I saw better result with the EDTA. This is the reason.
When you watch the unit in USA, the light instrument have a distributor. You can send us a mail later on the private, and we'll send you the contact. Well done, Chag Sameach.
Okay.
There
is another?
Yeah.
Okay. How can you go beyond the curvature using your laser tip? Is it flexible? Yes, it's flexible, and I can reach till the apical area. This is what is very nicely, but the tip, it's so delicate that it can go inside root canal, but you need to take care of him, because otherwise with your hand also, you can change his form. So very nicely, he's very flexible, and it can go through along the root canal at whatever you want until the apical area. I think this is enough. There was 23 questions. There is one. wonderful and informational lecture. Thank you very much.
So I would like to thank Sharonit for her lecture and for Dror for his participate. I just want to remind you that also Sharonit is coordinating the Continuing Education Center at Rambam. It's also together with the US Foundation that help us to create this Continuing Education Center, which is very important, especially for the north of Israel. And I would like to I would like to say happy holiday, Chag Sameach for everyone, have a kosher Pesach, and hope to see you soon on the 5th of May. Thank you very much and good evening.
Bye-bye. Have a nice day.
Can say something like, check recent activity.
That was wonderful. me
This
just
was
stop.
really a great lecture, Sharonit. Congratulations.